Welcome to Digital Health Talks, where innovators and changemakers share how they're transforming healthcare through technology. Join Megan and Antonelli, who will be shining a light on the good things happening in digital health.
Hi, everyone. Welcome to Digital Health Talks, where healthcare changemakers tackle tough questions shaping our industry's future. I'm Megan Antonelli, CEO of Health Impact Live, and I'm joined today by Janae Sharp, founder of the Sharp Index. And we are here to talk about the 5 good things that happen in healthcare this month. What month is it even, Janae?
It's May. Time is a construct. That's true. And I just want to say that this is my birthday month. So many good things happened, including we had conferences. You helped host a conference. Like we had birthdays, family celebrations, graduations coming up for a lot of people. So,
happy birthday, Janae.
Thank you. I love my birthday.
I've heard.
Probably from me every day this month. So that's a little good thing. Not everybody here had to listen to me say how much I love my birthday every day.
Well, it is an important day and we are grateful for it every day. So, and that knocks off one good thing. I mean, maybe that's all 5. Are we done? No,
I don't know. I do think a lot of good things happened from people that I know and from like just looking through LinkedIn.
It was a busy month. I mean, we had a great, I know you had the HIMSS Utah event. We had the HIMSS SoCal event, which was fantastic over at the Nixon Library. So we had a lot of fun there. It was really great to see, a full room, 200 people plus, people coming in on site. And just the conversations were really great. The CIOs that were there really had so much to share around, what they're doing with AI. John Henderson over now was Chalk, now Rady's Children's, talking about what they're doing and a lot with, virtual health and AI and ambient and a lot of the topics that we'll be talking about at
Health Impact, our summit next month in June. And we get to take a deep dive into what that will be like.
We do. And it is coming together so well. I am so excited. So, how we were last time in New York, it was rock star theme. We were talking about all the rock stars in healthcare innovation. Well, this time in June, we're pivoting towards the superheroes, and we've got a superhero theme coming together. That's like just so much fun. I go a little crazy with this stuff,
right?
But
I think the first inspiration came from this, right? From Jackie Gerhardt posting something from Epic UGM, right? And we love Jackie. Mm-hmm. And, she was posting about wearing a cape and also from talking to some people that we know about the work they've been doing in New York and nationally where, I don't want to dehumanize people. So I'm always like hesitant to call people superheroes, but a lot of the work that people are doing that we get to share, they seem like superheroes. Like they've done fantastic work. So like, I'm thrilled that we get to talk about it and we get to hear from repeat special guests who are, I think, kind of a big deal and great people.
For sure. And, and a lot of the inspiration came from Joe Desario introducing me to Gary Forbes, who we interviewed a couple weeks ago on the show, and he's the founder of Soul Survivors, which is, he wrote a book about superheroes for kids having chronic diseases. And, when we lean into and discuss the topics around children's health and mental health and adolescence, like with our partners, Road Recovery, which we had in January. But we're going to have Gary there talking about what he's doing. And I think while it can get a little cheesy and I guess dehumanizing, although, who doesn't want to be Wonder Woman?
I'm just sad when I don't have superpowers. I'm like, if I'm a superhero, I need a little more magic, It's fine. Side note.
Think, where it's so important, actually going back to the HIMSS event, it was Adam Gold talking about, what he sees, from a CTO's perspective, working in a children's health care hospital, what he wants to see in the future is more gamification for children's health, to get them really
I love that.
engaged. And I think, when you have these types of metaphors or what have you,
I have a thought about this too. Sorry, I don't want to interrupt. But okay, so at the Utah Hymns event, Billy DeMong spoke, and he's an Olympian. He's won multiple gold medals and led teams. And one of the most interesting things about his discussion was talking about the steps that they took to become innovative and to become winners, and just how it's like a scientific process. And you look at your behavior and how every step and every behavior that you have creates that win, creates something new. So instead of following along with what other teams were doing, traditionally the Norwegians were really good at that. They decided to look at all sorts of different and new ways of solving this problem. And that's what I think the lineup that we have will bring together, like that inspiration where these people are the best in the world, but they're the best in the world because they decided to look at the problem in a way that was relentless and change their daily habits. And that's what's necessary. If we look at things, especially with youth mental health right now, like even though some of the reporting on it is questionable and some of the data studies are invented, it doesn't take a scientific study. It doesn't take anyone to realize like youth today are struggling, and things are bad. Even when I think about our nonprofit work, when we're helping clinicians and families, the whole person, including the impact of youth mental health on our ability to deliver healthcare, is a huge issue. And it's something that's so pressing right now that I'm glad that you're bringing together these people.
Yeah. And I think coming around that topic, which is what we like to do at Health Impact, we like to talk about the fundamentals of technology, whether it's interoperability, security, connectivity, AI implementation. But at the end of the day, where does it touch the patient? Where does it impact patient care and outcomes? And I think right now, and maybe it's partially because, we've got kids and we see it every day and we're exposed to it through a lot of the discussion around the impact of social media, the impact on their mental health, and what that's shaping to be like for them. And that it is so hard to even just get the right care and get them to engage in that. So what Adam said really resonated with me. And I just, it made me so excited for what we're doing at Health Impact in June to really kind of, talk about what's needed in technology with the CISOs and the CIOs and, the financial, pieces of all of healthcare coming together, but then to kind of bring it home around, patient and adolescent mental health. So super excited about that. We have a lot of discussion around, virtual nursing. Of course, Kathleen McGraw coming back from Microsoft. We're there and they're such a great partner. I'm going to talk about some of the innovations that are happening there. She's put together an amazing panel with Carrie O'Brien from NYU Langone and Geeta Nastasi from Northwell, and talking about kind of the AI solutions for that workforce, which yes, often we call superheroes, because they for sure are. So it is, it's going to be another fabulous event. Another new addition is we're going to have the Microsoft startups. We have their Pegasus cohorts coming in, talking about all the amazing things that they're doing. Companies like Outbound AI and Careco and Humata are all going to be there. So super exciting. Thank you to Sally Frank for putting that together for us. And then one of the things I'm really excited about, and it's not even on the website yet, but it's a close friend and one of the most amazing superheroes in healthcare is Michael Rawlings, who is the COO at New York Health and Hospital, Lincoln Hospital. And he has been a longtime friend and a longtime, leader in healthcare. In fact, when Health Impact was founded, when we came up with the idea, that's when Hurricane Sandy was happening. And he was at Bellevue at that time. And when I tell you that he was part of the team who, on the technology team, on the operations team at Bellevue, but was downstairs bucketing water out of the halls. I think it was Bert Robles, who was the CIO at the time. So, and I just remember kind of knowing and being a part of that. So he's going to share with us that incredible journey from his, beginnings of, kind of that to now, and what he's seen with how technology has changed. Because when that happened, there were paper records for sure that were lost, that were challenging. And now we are luckily in a very different place.
Yes, I think
so it's nice to think of the impact journey we've had over those 15 years.
Yeah, just thinking about how far we've come and thinking about some of those repeat people who attend. Kathleen is a big fan, like just to attend for the community and for learning and moving together. And I've really enjoyed how the leaders there are so open to talk to people, but it's more like they're meeting with their peers to talk about the problems that matter. And we're having people who return, full circle, like Aletha Maybank is coming to speak about her work and her ongoing work.
Mm-hmm. And that's, and that theme and around kind of that intersection of art and creativity, again, Joe, kind of bringing that to us, is such a great, as we have AI being implemented and this technology adoption in healthcare, the humanity of healthcare doesn't change. And bringing in art and that intersection of art and medicine and music and medicine into all of this is so important. And that's why we love Health Impact, not to toot our own horn, but we do it a little different. And we bring in these different lines of thinking to inspire and to drive real innovation in the space. But there is certainly a lot of other innovation happening around healthcare. It's not just Health Impact, which is next month, but
Are we talking about Charlotte now? Speaking of innovation, speaking
of gems or diamonds in the rough or
pearls. A priceless gem.
Yes.
That you can find deep under the sea, but you could also find in downtown Charlotte.
Yes.
And I'm thrilled about some of the things that are going to be happening with the Pearl Innovation District. I've spoken to a lot of people who have been involved in that, including people from Wake Forest Baptist Medical School, Wake Forest Medical School, And they're going to have so many interesting people and have this space that's dedicated to innovation and that's dedicated to the future of medicine, both with technology, information, and with providing care. So that is, I think, next week, or whenever you watch this, very soon, we're going to open this innovation district. Is going to be dedicated to improving health, improving economics. Thrilled to be in Charlotte when this is opening, and the work the Advocate has done to make this happen. This is a years-long process, and so many different schools and leaders in the area care about improving health for everyone here. So that's something that I think is necessary. One of the things with innovation is that you need the space in which it can thrive and move forward. Mm-hmm. And this is providing that.
You're listening to Digital Health Talks. When we return, we'll continue our discussion on how technology is revolutionizing healthcare delivery. Stay with us to hear more insights on creating sustainable, patient-centered digital health solutions.
In the sort of evolution of the innovation discussion, right, is how do we make it happen? I mean, back, of course, in the Clayton Christensen days with, disruptive innovation, and you have to kind of put it over here to make it happen. And I think we've seen in healthcare it kind of go back and forth, right? I mean, there's been times where it's like, well, innovation has to happen in a vacuum, or we've got to keep it over here to make it happen because the others will push back. And I think we're seeing a convergence now where innovation is happening. And, I talk about it all the time when I talk about Health Impact, is when we started, it was CIOs. We were inviting CIOs. That was it. It was just those were the people we wanted in the room because they were making the decision around technology. Mm-hmm. But now that has changed. And not only is it the CIO and of course the CMIO and the CMO and the chief quality officer and the chief experience officer and all of the people who report into them, and the nursing officers and the nursing executives and, informatics and technology, of course, but all of those people, as well as the COOs and the CEOs, and of course the CFOs, because they pay the bills, are so important to that conversation.
We love you too, as CFOs.
Yes. And the conversation, to have everybody in the room, is so much more useful. And then I think with things like the Pearl and with the Helix in Houston, what we're seeing is a lot of cross-pollination, right? Like not just healthcare. We want to get people together, from economics, from finance, from government, from business, from defense. And, one event that I've been following quite closely, Emerge Americas out of Miami, they do that. They've got defense, they've got education, they've got sort of the quantum AI piece, and of course, healthcare as a hub. So that, it's just, I think the power of bringing folks together is so important. And that cross-pollination is so needed to drive innovation forward and get the right ideas, which also brings me to another great thing that happened this month, which is that the Women's Disruptive Leadership Summit, our second one with HFMA in Southern California, going to be at the Long Beach Yacht Club, which is one of my favorite venues down here. July 24th, we've just opened registration, and
people will come.
Yes. And, we work with the team at HFMA to help put that together. And it's the first year we went was great. Met so many unbelievable women, but to that point of cross-pollination, it is ACHE, it is HIMSS, it is HFMA, it is all those organizations, because now, they're all needed to have an effective conversation. We are not making technology decisions in a vacuum. We are having everyone come together to talk about innovation, to make it happen. So excited about that as well.
That's amazing.
That wasn't even on the original list.
No, I know, but sometimes things just pop out that are great. Like women who are making a difference, women who support each other. It's amazing. I've had so many great people like that in my career, and it'd be great. Like, I'm always wanting to go to meetings like that.
Yeah. And I mean, the discussion I had with Ann Tanner this week, who is also what has been a CEO, a COO, and a CIO, not to drop all the seats, but
she's been everything roughly, in case you're feeling like you haven't accomplished enough.
And she is a speaker at that event. And it was just such a pleasure to talk to her about her leadership strategy and about her mentorship strategy. And a lot of what she talked about was in not mentorship, but sponsorship, and what that means in leadership in general. It doesn't have to be a female mentorship or leadership, but sponsorship, where that you have an advocate who is willing to put something on the line for you, right? It's not just, oh, here's what I did, here's what you should do, right? Which is easy. There's no risk involved in telling people what you think they should do. But when you take that extra step to endorse them, put them at the front of the line for whatever new role or new opportunity, you're taking a risk. And that's what, that's how she was defining sponsorship. And I think it's so important when we talk about particularly women's, female run, female founders, like we often do, is, we're not just looking for allies, we're looking for advocates, and that's what's important. So lots of fun things happening, lots of events, lots of people coming together doing important things.
Right. And I think one of the speakers, Risa Lewis and Adira Landry, just spoke about this, about women advocating for each other and like what that looks like in the workplace. So that's an article. That's a good thing that came out that we can all read in Stat News. And I love Stat News.
I do love Stat News. And guess what? Risa's coming to Health Impact in June. So
I love her. She's so great.
And she's going to talk about some of those topics.
Let's go back to females who are doing well in business, because we personally know some people who just had an IPO.
Truth.
Two different companies I thought we should talk about this month. One is Omada Health. Lucia Savage is amazing and brilliant. She might not be the founder, but for me, she is.
She's definitely one of the more visible folks from that organization. So
right. And just her work ensuring that your data privacy matters and ensuring the security there legislatively and ongoing through her work at Omada Health. That's critical. Hinge Health also had an IPO. And I think they're a female founder or female-led fund who helped with that. Is that correct?
I think so. Yeah.
So I really liked it. I saw the little picture of them at, ringing the bell, and there were 2 little babies. We know I'm pro babies. So it was great to see.
Yeah, no, it is. It's super exciting to see. And it is an interesting time in healthcare in general to see these kinds of IPOs coming out, and there's been a lot of coverage around that. But there's lots of money there. And it's good to see that there's some successful IPOs. I guess we'll see how it goes in the months and years to come.
It's going to be fantastic, and everyone's going to do well.
Yeah. You brought up stat news.
Love them.
And recently, as I've been trying to find a barometer of truth in healthcare and in general, I feel like they're one of the only ones. And I just want to give a little shout out to them because there's a lot of just, and even, what the gray lady who I've got, sort of considered reliable sources, I can no longer really fully trust at this point. Because last week, when there's conversations happening around what these bills are going to do to Medicaid, there was no conversation happening on the national discourse about what was happening. And it's important. It's really much more important than a lot of the things that are being discussed. And it impacts.
We've shut down. And why do you think that is? Do you think that's because, you don't want to offend your sponsors? You don't want, is it distracting from the business that's still going on? Or is it just that we can't handle it?
God, there's so many answers to that, right? I mean, I
psychology, it's time for therapy with Megan and Janae.
Yeah, really. I mean, I think there's so much. And if we take it to what we know, right, which is in a world where everybody has to stay in business, right? When I was at Sway, I was on the panel.
Unfortunately, we're all still part of the working class here on this call.
Right, unfortunately. And paid content is a thing. Right. So there's paid content and non-paid content. And in a world of paid content and a world where AI is generating paid content and then AI is delivering your search results and you're getting what you get from that algorithm, finding the truth is hard, and I've gone to Substack and I've gone to things like that where I can then hear independent voices that I trust who are less in the hands of, or at the hands of many owners at the end of the day, whether it's your advertisers or your owners or just, fear of repercussions in general. I mean, look at, with what's going on with Harvard, with what's going, there is fear that there will be retribution in general, and it is breaking the system. And when it comes to, the likes of TMZ and Daily Mail, we don't care. But when it comes to healthcare, it really matters. And, the questions, and so that's business and capitalism and what's there. But then there's the question of do we believe in science? And does science matter?
Just basically. I think about that sometimes with mental health. By the way, speaking of good news, my child literally just handed me homemade gnocchi. But I think about that sometimes with mental health. It's do we believe in this? Do we believe in science now? Or is it more we've gone so deep down a Reddit rabbit hole when we were seeking answers and feeling not listened to that we'll believe anything? And that's part of the danger of digital health, because people don't naturally inside of us have a great way to measure. They've shown we'll believe garbage we read online if it looks like it's from a human being. And we don't cognitively have the ability to differentiate between that when it's real and when it's just something that we're naturally believing because of our instincts that have taught us to believe something a human has said. So that makes us more vulnerable to attacks nationally, internationally. It makes us more vulnerable to misinformation. Keita Nair talks about this a lot, and other leaders that we know. And it's a real threat being able to figure out, because it's physically something that you will have to consciously decide, but also being Google is not the same as science. Admitting that we don't know everything and that our judgment is flawed, that's a tough one.
It is. And it's complicated, and healthcare is complicated, and it is getting, it's not getting any easier. And with the digital health tools that we have at, our disposal, it doesn't seem like we're making that information accessible to the patient in the right way. And it could have been, it should have been. And certainly, the WebMD wanted to do it, and Medscape and around that. And to some degree still does, but that's not what comes to the top of your search results. Other garbage does.
I really do like the Medscape education team. We've partnered with them for some events. Like, they've done great work specifically and educated the industry. It's not the same as when we first would go to Google, and no matter what you had, you might have nothing. You might have a virus, you might have cancer. Like, it's a crapshoot. They're all equal, right? And so maybe that's a good thing, that we have had some advancement. There's some maturity in some of those decision-making things. There's also new regulations and cooperatives about the ethical responsibility that we have to ensure that our AI models and our internet has information that is more correct. And for those people who have been like kind of tracking this thing for years, it really is getting better.
Right. Sort of. Except that.
Sort of.
The parameters are there and the guidelines are there, but the reality of the experience, I don't think is there. I think
we still have huge opportunities.
Right.
It needs to get better. It needs to get safer.
And as you mentioned, Dr. G and her, her book wasn't published that long ago, and that she's she's rewriting it, doing another version, to it, because things have changed so quickly in that couple of years because of generative AI to some degree. Both using the generative AI tools to search and deliver the search results, but also the content that's being created is just, less and less reliable. And maybe we're talking about this because the New York Times, to their credit, did just report on the fact that the Make America Healthy Again report today was found to have false citations in it. Literally, at the highest level of government, we are using false citations for a report that is meant to justify.
It's like Chris Gibbons talks about, like, they might have used ChatGPT and hallucinated this.
So it is a problem, and it is a responsibility. I mean, I joke about, we're paid media, but we have from the beginning, even when we are paid to have sponsors and have them speak, ensured that it wasn't salesy and that it was a meaningful conversation. We guide and work with our partners to make sure that their conversation is about the value it will bring to the people in the room.
I feel like my major takeaway this month is that there's value in honesty.
I love that. And if you want to come to Health Impact this June, healthimpactforum.com, you can just go check it out, see the agendas, and register. That's Megan Antonelli signing off.
Thank you for joining us on Digital Health Talks with hosts Megan Antonelli, Janae Sharp, and Shahid Shah. For more insights on healthcare innovation and a deeper dive into today's discussion, visit healthimpactlive.com. Join us next week as we continue exploring the technologies and strategies transforming healthcare.